Good afternoon, Tewksbury. It is 1:01 p.m. on Wednesday, May 20th, and I'd like to call this special meeting of the Tewksbury Board of Health to order. And since we are doing this as an online meeting via WebEx, I'd like just to have us start off with a online roll call. So it's myself, Chair Ray Barry. Maria?
Maria Zaroulis, clerk.
Dr. Bichetti?
Yes, Tony. Yep, I'm here. Thank you, Ray. If
Okay.
I'm disconnected on my drive, call back in again.
Okay. And if we can have health department staff?
Susan
And then
Sawyer,
town
health director.
Irvi Agrawal, public health nurse. Shannon Sullivan, sanitarian.
And then town staff.
Yep. Steve Chadwick, assistant town manager.
Hello, Steve.
Hello.
So, Susan, I guess I'll turn it over to you. And I guess the only question I have is, now that we have the business reopening started, and I know that we're in phase one now, and some businesses are already open this week, others are slated to open next week. And there's been a lot of talk of the time of how long each phase will last. The only thing that I've seen, which may be the reason why there's sort of a pause between, besides trying to get guidelines for each type of business that would be allowed to open in the next phase, is purely and simply everyone on the business owner side needs to ensure that their staff, and for customers as well, that there is appropriate PPE and hand sanitizer. And I've been seeing some reports that there may be issues in sourcing, or is there enough stock out there? And just sort of, as you hear from you, Susan, and you, Steve, what's happening in town, I'm just curious to know, has there been any reports of anyone in town on the business side that's either opening or trying to reopen next week that's having a hard time getting the required PPE or hand sanitizer?
So, hi, everybody. For that specific question, I have not received any requests about where they can get PPE, although I do know that there's some guidance. I haven't clicked on it myself on the state website that's supposed to guide you to people, that have these different items. Definitely need to check that out. That'll be questions. We have been working on a process. What's that, Tony?
I was saying I agree with you, Susan. I haven't heard anything, but I think people are pretty resourceful. I know just this morning I get up early, and on the TV there are companies that are having, they say they have plenty of hand sanitizer and stuff. People just have to order it directly from them. So I absolutely, people need to have the PPE required to open up. If they don't have it, then that's, then there's issues there. But I honestly think people are pretty resourceful getting what they need to have, because, as I said, I haven't heard any complaints from it. I do know that in some cases, some major distributors, they are being told until the government releases some of the PPE to some of, like in our business, for example, if we don't have it, there may be a little bit of a weight on it, because the government is kind of holding it back to make sure the hospitals are all set. So I didn't mean to interrupt, but I just know, I'm dealing with this stuff minute by minute in my business. So I do know that most people should be able to be resourceful enough to get it, or realize they may have to wait a little bit to open up until they get it. But as I said, I saw today lots of hand sanitizer that's the CDC, FDA regulated, CDC guidance, the recommendations for the percentages, 60 and above percent, and they were marketing it on TV. So I'm sure people can get the stuff. They might have to do a little due diligence, though, to get it. But that's all. I just wanted to, bring that in while you were bringing it up, Susan, because I haven't heard anybody that can't get it if they really want to.
Right. And of course, the Board of Health has been spending the last couple of weeks, repeating to everyone, please start getting your plans together and start thinking about how you're going to reopen. Hopefully that sunk into some of them as they were waiting patiently or impatiently, whichever it may
I
be.
agree.
through
Yep,
this
I agree
time.
with you, Susan.
So, yeah, and last week we had mentioned that Richard and Shannon had been sending out, and Lisa had sent out an email to a number of businesses in town, and we're looking to send another one. And I probably will hand off to Steve to tell him you what will be in that type of email, and then of course that will end up on social media too. So we're just trying to help people out, right here in Tewksbury. So go ahead, Steve. Do you want to make a comment?
Sure. So, good afternoon, everybody. Basically,
Good afternoon, Steve.
the email is explaining to businesses, it's going out to all of the businesses off of that list that the health department put together. But it's basically providing the businesses with links to the state website, and it explains that it's a self-attestation process. So as far as compliance is concerned, it explains that there is no requirement for the town to approve the establishment's control plan for self-certification. And then the links, just going through them real quickly. One is the state guidance for industries on the reopening plan. So you can go into that portion of the website, look up your business type, and then it'll tell you the date of opening and what you need to do to comply. And then there's the general workplace safety guidelines, which is another link that's provided, as well as sector-specific protocols and best practices. And I was looking through that just for town offices, and it is a pretty extensive list of protocol and best practices. So that will be helpful with the businesses. And then there's the COVID-19 control plan template, which is a 2-page document that's on the state website. There is the employer and worker posters that are supposed to be put up in the workplaces. And then there's a compliance attestation poster that's supposed to be available for the public to see that there's compliance with all of the COVID-19 requirements. So, so we're in pretty good, once this goes out, we'll be prepared. And I even list here that we would help people, guide them through the process if necessary. So it's not that we're taking this on, we're not going out to enforce it unless we receive complaints. And just to let you know, I've already talked with one spa owner and one hairdresser and assisting them in putting their package together. So, I think we're in pretty good shape to try and get the businesses up and running and comply with the state guidelines.
So Steve, maybe you can just talk about what your newly appointed role is. I know you wear many hats, but you have a new hat you're wearing now.
Yeah, so this one in particular is just for business assistance. So if there's questions on how to reopen, they can contact me directly. The other thing that we kind of kicked off, because this was coming at us last week, is we're trying to do our best to expedite requests that people have that are outside of their normal service delivery. So this bit about outdoor seating, we've received 3 requests already, and I've assembled a team to look at these and to start talking with the owners about it. We have another request that's come in to use a parking lot for COVID-19 testing, and that most likely we're going to refer to the planning board because they just finished the building at Circle Health. And then I have a request for an open air recital and possibly an outdoor gym. So those types of things where people are expanding or doing things differently, we're going to try and give it a good, quick look. I mean, there's things, liquor licenses need to be amended. There's public safety concerns about outdoor seating and people pulling up to where the seating areas are. There's fire code issues, handicap accessibility, building code, and then zoning analysis. So we're trying to do all of this as quickly as possible in a very informal way with the owners as they're reaching out to us, because we don't want to be an impediment to people opening up and using their imagination on service delivery.
Well, I applaud the town and its efforts for trying to help business owners that have been negatively impacted by this pandemic to try to help them open up their businesses as quickly as possible and helping them navigate these requirements. So thank you for your efforts.
Sure.
One thing I wanted to mention that I actually just thought about is, there's a lot of focus on the places that aren't open. But just like we were talking about what we need to do here as essential business being the town hall, there are a lot of businesses open that probably aren't paying attention, that they need to do these attestations and things that, we'll try and help as we go around. But anyone who is there as a customer or an employee, or you shouldn't hesitate to mention anything to your boss or something. Everyone's very busy, so just say you're doing all takeout food. You're thinking you're just fine. You're not even maybe realizing you have a lot of things that you need to do as well. And there is a deadline actually this Monday for places that were already open to start complying for certain things, and then there's other deadlines too. Again, we're just going to try and help people, but that's a sector that I don't think they're really probably paying a lot of attention because they're just working. They're just doing their job.
May I add one thing? Exactly, Susan. I agree with you. And for Steve, if they could put all the members of the Board of Health on the distribution list, that everything that gets sent out from Steve's department or whatever, because a lot of people will contact us. But I do think when the email goes out, I think it's very important for us to let them know that these businesses, they have to make sure they're ready, prepared, they have to self-police, and they do have to sign an attestment in many cases to the state, because what will happen, there will be, I am sure, liability issues if there becomes an issue where someone files a complaint or whatever, and they've attested, because it's mostly self-policing. So I think it's imperative for us when we send these emails out to people to let them know the onus of burden is on them to make sure they have it. There's a lot of prep work they have to do before they open, assuming they have the PPE, because that list, as Steve said, is very, very extensive. It pretty much is a cookbook about what you need to do, but many people have to adapt their specific environment, their specific circumstances to incorporate the best management practices of the guidelines that are set. So I can't stress enough that when we send these emails out, that every email we put a claimer is, as Steve said, we're really only doing enforcement if complaints come out. But people better get their acts together, because the consumer buying public will be the ultimate judge of probably their success or failures if they do not do everything the way the public expects it. Because everything that we are requesting the businesses to follow for guidance, the public has immediate access to it, and they will probably know the rules better than some of the clients going into their establishments or patrons. So, as I said, Steve, because we do get calls from people on the side. So if you can just put us on that distribution list, so everything you send out to the people, we can already be aware of. I'm aware of the forms you have, but I think if we're on that email distribution list, that will just help us to reinforce things for people. Thank you.
Got it.
So I guess, Irving, where do we stand with COVID cases now in town? I saw a report yesterday online. Again, what you see in Facebook isn't always accurate, but it seemed like the state hospitals become more of a concentrated hotspot than it has in the past. And I know the last time numbers were posted, thankfully it was showing what we had for sort of residential cases versus those at the hospital and assisted living facilities. Where do you see things headed now in terms of numbers, or what has the track been in the last couple of days?
Sure. So we've had a really good, actually, last couple of days in terms of numbers for residents in the community. We've gotten, most of our cases have been from either a congregate site or from the hospital. So very few in the community, which I'm so happy that that's happening. We're doing a good job with our social responsibility to physically distance and, hand hygiene, and we're doing things right. So keep it up. I know as things start to open up and people are, returning to work or out and about, that we may see a little bit of a spike in the community or the resident cases. But as of right now, we're doing really well. I don't have the exact numbers right in front of me, but I know that there are more recovered people at this point than there are active cases, which, which I never thought would happen, to be quite honest, because for a while there, our numbers were really, really high. So keep doing what you're doing, Tewksbury, and we're ready for another little uptick, as I'm sure, as will happen when businesses start to open. But we can do it. So
Okay, well, thank you for your update.
you're welcome.
So
So,
Susan,
yeah,
go ahead.
so as I said, we are hearing from some customers and some employees. We're just starting by making a call out to talk to managers about mask wear. I think that's one of the things, if you're in a small firm or a small office and the boss isn't wearing a mask, and they're in a place that's supposed to be wearing a mask when they're supposed to comply, we'll start by sending out a call to just talk to them about things. So I think employees are calling. We are partnered with the Department of Labor and Standards. So if we need assistance, it's primarily enforcement of this is with us and Department of Labor and Standards. So they would also either send a letter, or if we had needed more issue with that. So people can call us, or they can call Department of Labor and Standards if they have issues.
So Marie, do you have any questions for anyone that's on the call today?
Yeah, so to go back, I'd like to ask Steve a question. I know that he mentioned, Steve, you were assembling a team to help these businesses, maybe add outdoor seating, et cetera. Do you have any idea what the timeline would be that they would find out that they would be able to do something like that? Like, will it be by the date that they're able to be open, or will they know sooner than that? Because I have heard a lot of people asking that question. I'm just curious. I'm sure there's a lot involved in trying to set that up for them.
We're going to move. Is that me?
I think so.
Yeah.
All right, I'll try again.
There you are.
Is it still echoing or not?
Okay.
When it becomes too much, just somebody raise your hand and tell me to stop. So we're trying to move as quickly as we can on this. Things like liquor licenses are going to take a little bit longer. And we're also receiving information from the owners that are not on standard forms. I have handwritten plans that people are giving me. So we're looking at what we get and we're trying to make an evaluation. That's why we're trying to set up calls with them so that staff can actually have a conversation with them. Building commissioner, Susan, myself, deputy police chief and fire chief have an appointment at 2:30 today to talk to one of those businesses, but that's kind of the process as I see it moving forward.
Okay. Thank you.
Yep.
One of the bonuses of these types of meetings, easier to set up, when it's not a board meeting. So it's easier for us to do that. So we're all trying to accommodate as much as we can. We don't know all the answers, that's for sure. One thing I can tell you is the documentation and checklists and information is voluminous. And Shannon and I'll send her a question. She'll send me a question, what about this and that? And she'll search and try and find the answers. It's not always easy.
Yeah.
Hey, I'm going to focus on these checklists and sheets now because that's what they have to do. Like I could look back at weeks of information, but the most recent stuff, I think we're going to focus on learning. There's just too much to learn. It's such a short amount of time.
Mhm.
And sad that we don't know what's coming up in phase 2 or 3. Like they don't give us all the information. So people may know they're in phase 2, but they don't have a check sheet yet.
Right.
For their particular. I wish it was simpler, to be honest. I wish it was more just easy to understand, so that there weren't all these individual little pieces for every little business. But that's not what we have. So we're working with what we have the best we can. So.
Well, it's concerning because, phase 3 and 4 don't really have definitive dates, it looks like, which kind of leaves everybody up in the air. What do we do now?
Yeah, especially with anything to do with the child, recreational camps and things like that.
Mhm.
We have every August, soccer camp. I haven't heard from them yet, but what could I say? If your soccer camp in August ends up being phase 2, please let's not pretend. I hope it's not that. But if it were, I'd have to say, oh, well, you can have it, but you can't have contact soccer. You just have to dribble up and down, which is not. So it's hard to answer those. How do you sign your child up for something when you don't know? So the camp, we're really pressing DPH to get camp guidance, and that's a priority.
Just two things to add to what Susan was saying. I was on a call yesterday with Mass Municipal Association, and the Lieutenant Governor had said that they expect the minimum length of the phases to be 3 weeks. So I guess as far as just a rough idea, that's kind of what we can anticipate when we're talking to people. That's all we know, and it's come from the Lieutenant Governor. And then Susan, on summer camps, they said that they were hoping to get guidance out either this week or next week on camps. So hopefully we'll see that shortly.
I did hear that also, Steve, about the 3 weeks, but that's not even written in stone either, because it's really going to be up to the discretion of the committee that they've got together. But yeah, the 3 weeks. The other thing I was going to ask Susan as well, you're right, Susan, it's so voluminous, this material, and I'm going to urge again, any business owner, we're not in the business of telling them how to run their business, because a lot of these guidelines that they put, people have to sit and take the time to do it, because you folks are very busy at the Board of Health Department right now, and we're there to help. But I don't think, I can envision some people wanting other people to do their own work for them. And I don't think that that's the Board of Health total mission. I think we're there to help, but you can't give them the plan. I honestly think any business owner, and I have a business owner, and I've had businesses for 40 years, that you better know what you're supposed to know. And yes, this is voluminous, but I would hope that all the business owners in town do not think that the town will be able to put their plans together for them. We can guide them a little bit and help them, but they actually have to put a lot of skin in the game to do it right, because this is part of the cost of doing business. And even though things change, they do have to be involved in the process, and we may learn some things from them. I find some pretty ingenuitive people coming up with some pretty good ideas, but I honestly think that, like I said, we just got to make sure that people are doing their due diligence, because if they don't have the PPE, that's one thing. If they don't have the proper procedures and protocols set up for their particular facility, then they need to spend more time doing it, because, as I said, ultimately I believe that the public will be the ones that determine, on top of their hard work. I mean, this is the standard. You are expected to be doing these things, so the public will be their ultimate overseer. And I just think that you folks there's not enough hours in the day to be doing things that people want a handwritten plan for them based on all the different intricacies of this program. So as I said, I think we need to be helping them, but we can't do the work for them. This is part of what they need to do to stay in business. Thank you again. Like I said, I apologize if I'm talking louder. I'm driving. There's some construction I'm passing through, so I'm not sure if you can hear me. I can't hear myself sometimes, but thank you.
Oh, we can hear you loud and clear.
We can hear you fine,
Susan,
John. Yep.
anything to share from
Well, that's
either
good.
your meeting with your counterparts and other health directors, or Irvi from the DPH calls that you folks had yesterday?
You know, if to be on a call, it's like playing a ping pong game. You know, one question about one thing, and all of a sudden we're talking about you know, pools and camps and beavers, and it just goes back and forth. I find myself just jotting down notes and then reaching out to my colleagues. It's very helpful because they just let us hammer questions at them and then they respond later. There's a lot of question just about, you know, the different dates and things that people have to get things done. And we're not the ones, unfortunately, we can't answer the question for why someone's not in phase one or when that we can't, why something isn't equal to something else. That's out of our hands. So we're just trying to figure out the streamline as much as we can. But it's just one question at a time, trying to help see how each town is handling different things and putting them together. So just ongoing, working together. It's good. Do you have any thoughts, Irvi, about your call?
Yep. So I had a call with the Maven people yesterday, and we basically we didn't actually talk about reopening at all. We talked more about the Community Tracing Collaborative and kind of like what their operation process is, because there hasn't been a lot of transparency for the local boards, just because, you know, they were in a rush to kind of put something together, and so they didn't actually even have a map. So now that they're, you know, going back and kind of looking at their processes and trying to get an SOP together, we had a couple of members of Partners in Health, couple of, I don't know exactly what their titles were, I'm sorry, but a couple of people from Partners in Health really answer our questions, because there were a lot of questions. You know, there was a lot of question of, like, how many attempts are made to call people before they're listed as lost to follow up. And, you know, they reassured us, they actually went through how many times they actually call a person before they release them and say, you know, we were unable to contact this person. And of course, being at the local level, I always want to make sure that I'm in touch with everybody. So if I do get one back, I will try to kind of find the person, you know, whether it's reaching out to the hospitals. You know, usually it's either Winchester Hospital or Lowell General. Got a good relationship with the infection preventionists there. So I can usually call them and see if they have a different phone number or any other pertinent health information. And so that was what our call was about yesterday. It was good. It was very informative for us at the local level to understand what Partners in Health is doing in terms of the Community Tracing Collaborative.
Okay, thank you. And then I guess, go ahead, Joe.
No, I was just going to ask Irvi. Irvi, has there been any discussion? I know you're working very hard like everyone else, and thank you, but has there been any discussion amongst the people you deal with that are dealing with the tracings, showing the diminished returns of all the energy expended in contact tracing right now? I'm wondering if there's just a discussion, because everything that I hear from experts, that at this stage of the game, with the volume of COVID-19 that's been diagnosed, and the contact tracing is a little bit of has a lot of a diminishing return on it right now. It wasn't designed for the size of the population that we're dealing with. And it seems like a lot of people are spending a lot of time that may be better used elsewhere. Has there been any discussion amongst your colleagues with this, or they're just kind of, you know, going, because I'm not sure what the government's and what state of Massachusetts is outlook. I believe I have an idea what it is, but I just hate to see time being wasted on when it could be addressed to more important thing. So I was just wondering what your colleagues had thought too.
Yeah, sure. So kind of, I mean, what they're doing is, I think, worthwhile in the sense that we're doing data collection, first of all, with the people that we do get in touch with, which is priceless right now because there isn't any data. The other piece of it is that sorry, I lost my train of thought, is the data collection uh, and reaching out to people and making the effort to reach people. I remember what I was going to say. So the other piece of it is now the State Department, the Health Department is now recommending that if you are if you are named as a close contact of a positive case, the new recommendation is that even if you are asymptomatic, that you should be tested because the idea is trying to stop the spread. So it's basically to catch those cases really, really early on and get those people isolating before they spread virus to other people, especially if they're asymptomatic. So I think that piece of it is priceless if we do, in fact, want to stop the spread or slow the spread. So that's kind of the new thing right now. And I think that's what we're really focusing on is getting those close contacts tested sooner rather than later so that those people can isolate and stop the spread. So I think what we're doing is definitely worthwhile. Trust me, I've been there too, where I've been like, there's too many cases, it's too much to do, this is pointless. But I think when we come out of this, the information that we have will be very valuable. Really, what DPH is looking at is they want to know hospitalizations, complications such as pneumonia or acute respiratory distress syndrome. They want to know what the outcome is. Did they pass away? Did they recover? Because they really are trying to learn all about the virus that they can. They want to look at demographics. Is it affecting one population more than another population? So we're really in that data collection stage. So while it is a very big task to take on, I think when we're out of this, the information that we have, that we will have gained, the knowledge that we will have gained will be the fruits of our labor. So I think in the long run, this is a good thing that we're doing. So that's kind of that's how I feel about it.
Okay,
I think
well,
other people feel about
no, thank you. Thank you, Irving. Yeah, so basically they're still, they're just transforming from one area to another. And I do understand the data collection and the importance of it. I was just looking at it from the manpower and the time and things that are necessary to follow this. But I get the data stuff. So basically, it hasn't been discussed diminishing returns yet. Okay.
I think the other piece of it is also to put money back into the economy, kind of slowly. So they've hired a very large workforce that they're able to pay. And, if somebody's out of a job, this is something that they could have applied for and, make a little bit of money. So I think it's kind of I think it has economic returns as well.
Well, Irving,
I kind of thought that it might. Go ahead, Ray.
I think the other important aspect of the continued contact tracing, even though you look at it, well, we're already past the peak, so why do we continue doing it? And I think there is so much that is evolving for knowledge on COVID, both about the symptoms, how it actually impacts patients and what underlying medical conditions they have. But I think more importantly, they need to get a better handle on how is this transmitted. Because if you're worried about a second flare-up this fall during flu season, having more awareness of how did this start spreading in the first place will then look for them to start practicing preventive measures as opposed to everything being reactionary at this point. So I think there's a lot of value in the contact tracing because all we know in Massachusetts is we have that famous Biogen conference where someone from Kentucky came up that supposedly had it, and all of a sudden we went from 1 to 25 to 90 attendees at that. And next thing we know, Massachusetts is the third highest concentration of COVID. So it can't all be attributed to that one conference. So having some better awareness of how it transferred, and especially to all the healthcare facilities, I think would be vital if we're trying to stop this from reoccurring.
I think the other piece of it is, and I was talking to Susan and Richard about, and Steve also this morning, is that we need to change our frame of thought. You know, as a nurse, I'm constantly washing my hands. Like, I'm just like obsessed about it, just because like I'm just like aware of how dirty my hands are, or covering my cough or whatever. And I think, as you know, as a general population, in terms of prevention, these are things that we all need to start thinking about. You know, we all need to, yes, you can wear gloves or you can wear a mask, but really at the end of the day, it comes down to, you know, the hand hygiene, the covering your cough, and, you know, like you said, right, that once we get to the fall and then we've got flu season, we're opening up parts of the, you know, parts of the country, people are going to be more out and about. So I think that once we become more aware of, you know, how to stop the spread and the importance of the hand hygiene, I think that that'll make a big difference as well. But it's just changing our mindset, and it'll come with time. But can't stress the importance of hand washing and good cough etiquette. So, yeah, we just have to
No, I
change
agree
our
with you, Irvi. I think if one good thing comes out of this, people start to do what they should have been doing all along for years to avoid spreading the other diseases. So I agree with you on that. Good hygiene has been around for years, and if nothing else, this will reinforce it much more so than people have been aware of, even though they should have been doing it all along. But I agree with you. Thank you.
Yeah, Shannon and I would totally agree with you as well. And I do like to look at the bright sides of things. We're always trying to find new ways to get people to think about what seems to be common sense, just because it's in a rule, but we want it to be second nature. Like you said, we want the food establishments to think of it as a second nature. I mean, they can stop foodborne illness. It's something that is a preventable problem. And so if this can help that, I'm good for that.
No, exactly. It's good. You know, human nature is such that you constantly need reinforcement and recalibration. So as I said, I thank you. I definitely agree with that. It's just a little frustrating sometimes being someone that deals with this all the time, and you see it. You see people not getting it. It's like after 3 strikes, you know, you're out. So I think that right now, because of the awareness that everyone has, I think it'll be the best monitor system that we have, because, like as I said, if businesses don't, and I'm going to businesses as well first, but you know it applies to the public in general. If people aren't doing what they should be doing based on the current knowledge available and current best management practices, then I'm sure they'll be called out, or their businesses may find lack of patronage over time. So I think that is a good thing, and it just reinforces what we should have been doing since, I don't know, I'm pretty old, and my mom said to wash your hands and do these when I was a kid. So I'm glad that people are following it.
So anything from you, Steve or Susan, that you want to mention that has not been brought up yet before we end today's meeting?
No, I appreciate the input you received on the message out to the businesses, and we'll look to incorporate it.
No,
Again, thank you for your efforts.
I'm good for today. We have tomorrow.
Yep, that's right. We have. That's right. We'll do the plug. So we have our normally scheduled monthly Tewksbury Board of Health meeting at 6 p.m. tomorrow on WebEx, where there are things we can talk about other than the pandemic. Okay. Anything else from you, Maria? Okay. Joe, Tony, you about to say something? Okay. Well, we do have 3 board members on the call, so that still constitutes a quorum. So if one of the 2 of you would like to make a motion to adjourn today's meeting.
I'll make a motion to adjourn today's meeting.
Okay.
And I'll make a motion to second my esteemed colleague's first motion.
Okay, so motion's been put forth and second to adjourn today's special meeting of the Tewksbury Board of Health. And we'll do an audible roll call. So yay or nay, Mr. Rulis,
Yay.
Dr. Bichetti,
Yay.
and chair votes aye as well. So motion carries unanimously 3-0. So it is now 1:41 p.m. So good afternoon, Tewksbury. And again, the Tewksbury Board of Health will have its regularly scheduled monthly meeting tomorrow at 6 p.m. That will be a WebEx call as well. So thank you all for joining today. And thank you, Steve, for participating today. And we appreciate the town's efforts.